So with that, request for bill introductions, do I have any? Representative King.
Mr. Chairman, I'd like to introduce a committee bill 25 RS 0533.
And a brief description.
Act dealing concerning healthcare related supplemental nursing service agencies.
Committee objections? Seeing none, bill is entered as a committee bill. Very good. I guess we've got just a little budget today to start out with. Very, very small, one of our easier ones. So, and the other thing, the chairman hasn't quite developed this yet, but this is the most exciting committee in the State House. So I just want to make sure that everybody understands that. And with that, we will have our Jill. Sorry.
On the bill introduction, may I have a point of order? I just need to know if the requester is introducing the bill on behalf of anyone.
Yes, it'd be on behalf of Leading Age.
Okay. Sorry about that. Okay, and now we have our research analysis for KDADS to give us a brief overview of the KDADS budget. Thank you, Dayton.
Thank you. Good afternoon, Vice Chair Carpenter, members of the committee. Dayton Lemunyon, Senior Fiscal Analyst with Legislative Research. I know we're paperless, but I have dropped a stack of papers off in front of you. I think that they'll be helpful as we go through, and I sort of have them in order of which I intend to talk about first. So I'll show them as I talk about them. Before we get into the budget, I kind of want to contextualize the budget using this pie chart that you have. You see the largest slice of that is titled Medicaid. So 89% of this agency's budget are Medicaid dollars. That includes nursing facility reimbursement, the home and community-based services waivers that I'll get into later, as well as behavioral health expenditures through Medicaid. The next largest would be behavioral health, which includes grants and other non-Medicaid behavioral health programs. And then you see that dark green slice on the pie, 4% of their budget represents their aging commission capital improvements for the state hospitals, long-term services and supports, operations, the state hospital commission, and their surveying commission, which surveys a number of adult care facilities. So just wanted to contextualize the budget before I get started. Are there any questions at this point?
Committee questions? Seeing none, continue.
Okay. Then the next sheet in that document is a yellow sheet, which includes the governor's differences. So these are items that the governor recommended in the governor's budget. So primarily you'll see enhancements that were not recommended by the Legislative Budget Committee, as well as two other items. Before I start going through the Legislative Budget Committee recommendation, I'll point to those. If you look to fiscal year 2025, the first item deletes $3 million state general fund to adjust the reimbursement for counties and hospitals for costs in holding individuals who are awaiting competency evaluation and treatment. So this is revising an estimate in the budget. The second item is to delete $4 million, including $1 million state general fund, to transfer funding for the ePasser tool to KDHE. I believe you heard about this item in the KDHE budget as well the other day. So those are the two items in the governor's recommendation that are not in the budget summary. So looking at page 1 of the budget summary, I'll note, if you look to the other assistance category, that is $2.7 billion in 2024. The bulk of those are those Medicaid payments. If you go down to the financing, you'll see there's a pretty close to even split between the state general fund. This is, sorry, on your computers, this is the budget summary.
Hang on just a second, Dayton, so committee, this will be on the S drive on the committee, and go to social services budget, and everybody find it? Very good, thank you.
Okay. Thank you, Vice Chairperson. Sorry about that. So now the other document in front of you, I'll just repeat what I said. If you look to fiscal year 2024 actuals, $2.7 billion was in other assistance. So the bulk of that will be those Medicaid payments, and that is the bulk of the budget, as I mentioned. Moving to the financing, you'll see a pretty close to even split, closer to 60-40, between State General Fund and Title 19 dollars, which would be the State General Fund for the agency, as well as whatever match they get from the federal government, primarily for those Medicaid programs. I would then turn to page 2 to get into the fiscal year 2025 analysis. The fiscal year 2025 approved budget, including reappropriations, was $3.6 billion, including $1.7 billion from the State General Fund. The agency's request compared to that approved amount was a decrease of $111 million, including a decrease of $165 million from the State General Fund. Moving down to the table, the first item that you'll see is item 1, State General Fund reappropriation. The agency did reappropriate a number of dollars that were unspent in fiscal year 2024. I've broken these out by category, so I'll go through those individually. The first item out of that $282.6 million is $150.5 million for the home and community-based waivers. This funding was actually a reappropriation largely from fiscal year 2023 that was carried forward. During the public health emergency related to the COVID-19 pandemic issued by the public health emergency issued by the federal government, the state received an increased federal medical assistance percentage. So instead of receiving 60% match, it increased by a different number, which varied throughout the public health emergency. When the agency had submitted its initial budget a couple of years ago, they estimated it would end earlier than it actually did. So they ended up getting a larger federal share for a larger part of the year. So the bulk of that was so all of that $150.5 million was related to that extension. The agency did carry that forward last year. However, they did not expend the funds. The revised estimate, as I'll note as we get further into the budget, does lapse $150.3 million of this reappropriation. And if you'll turn to page 3. The next item is also related to the public health emergency, specifically for the home and community-based services waivers. The federal government authorized a 10% FMAP increase. So again, instead of a 60% match, the federal government was matching it at 70%, as an example. However, the savings, the State General Fund savings from that were required to be used on HCBS programs. So the savings must be used to improve or further the HCBS programs. Originally, that was closer to $90 million. The agencies had $45 million left over that they reappropriated into fiscal year 2025 for those ongoing projects. This funding was deleted by the Legislative Budget Committee. Moving to the next item, CanCare caseloads. $36.5 million was reappropriated from last year that was unspent for caseloads expenditures. This was reevaluated as part of the fall consensus estimating process. So I'll discuss that later when we get down to the Fall Human Services caseloads estimate. The next item, $35 million for the Sedgwick County Regional State Hospital. That construction is ongoing, so the funding was reappropriated from last year. And finally, $3.7 million in state operations for ongoing projects that I've listed there in the text. This funding was deleted by the Legislative Budget Committee. That was a lot. Vice Chairperson, would you like me to pause for questions on that or continue with the budget?
Yes, let's pause here on 2025. Committee questions on 2025. Representative Wilcott.
Thank you, Mr. Chair. So there's a breakdown here. It looks like of those bullet points you went through, a couple of them have an LBC deletion. The other ones do not. The ones that are not listed with the deletion are included in the LBC's recommendation.
So you're correct. The HCBS 10% FMAP was deleted by the Budget Committee as well as the state operations. That first item, the home and community-based services waivers, was lapsed in the agency request, which the Legislative Budget Committee did agree with. So the $150 million is also lapsed.
Thank you.
Committee, further questions? I have a few. So of that $150 million, is any of that going to be returned to the federal government?
Vice Chairperson, not of the $150 million, but if you'll look at page 3, the HCBS 10% FMAP, the $45 million, that funding, that savings had stipulations to it that it must be used for HCBS projects. So my understanding is that, yes, the funding would have to be returned to the federal government.
Thank you for that. And I would think that the agency has recommendations for what to do with that money. Very good.
May I follow up on that?
Representative Ballard.
Just want to follow up. We have to return it, but how long do we have to use it? Do we use it through 2005 or going into 2006?
Vice Chairperson, Representative, I can't recall. I think the deadline was extended. I'd have to check. I think I have it in my email, so I think the agency probably can answer it, but if not, then I'll pull it out for you when I get back to my computer.
Thank you.
Very
Thank
good.
you, Mr. Chair.
Committee, further questions? Seeing done, continue on to 2026.
2025 still, on page 3. So we're on the SIBF reappropriation, item 2. The agency, KDADS, receives capital improvement funding from the State Institutions Building Fund on behalf of the 4 state hospitals that I presented last week. So the agency reappropriated $9.9 million in state institutions building funds for projects that were approved but not completed in the prior year. And then item 3, the Nutrition and Services Incentive Program. The agency requested $1 million to provide grants to organizations that sponsor elderly nutrition program sites. The request was due to the federal government cutting $650,000 from this program for fiscal year 2025. The difference between the $1 million and the $650,000 would not only meet that cut, but it would allow wait lists to be reduced, wait lists for these nutrition sites. And the Legislative Budget Committee did delete this as part of its deletion of enhancements. Item 4, and the governor also did not recommend that item for fiscal year 25. Moving to item 4. I've already given a little bit of a preview on this one. The agency's revised estimate includes a decrease of $150.3 million to lapse a portion of its state general fund reappropriations. And that is due to the public health emergency being extended and for savings for the waivers. So the agency did lapse that. The Legislative Budget Committee did concur with that lapse. Item 5, the 24/7 pay plan. You might recall when I presented the hospitals, there were a number of transfers into the hospitals for the 24/7 pay plan for shift differentials. This reflects the decrease in the KDAD's budget due to it being transferred out. So between KDADS and the hospitals, that is a net zero impact on the state budget. Moving to item 6. The agency receives federal funding to match state funding for Medicaid programs. The revised estimate includes an increase of $44.8 million, all from those federal funds. due to changes in the federal medical assistance percentage. And I've noted there that this is primarily related to that FMAP increasing from 60.18% in the approved budget, the budget approved last year, to 61.65 in the agency's request. Item 7, the revised estimate includes other adjustments resulting in an all funds increase of $8.9 million, including an SGF decrease of $218,000 and an increase in 26 FTE positions. I've noted there that some of the FTE positions are related to temporary positions that will administer the 10% FMAP funding. The Legislative Budget Committee deleted 11 FTE positions. And finally, item 8, the Legislative Budget Committee added $130.5 million, including $2.4 million state general fund to adopt the fall human services caseload revised estimate. Primarily driving that increase are changes in population and rates. And if you'll turn to page 5, the caseloads estimate for the fall also includes $47 million, including an SGF decrease of $7.8 million to rebase all certified community behavioral health clinics in fiscal year 2025. The full rebase is required as part of the state's participation in the CCBHC planning grant. However, participation in the grant allows CCBHC expenditures to be matched at the CHIP rate, which is 75%, as opposed to the typical 60-40 split. So the increased match does result in a decrease of $7.8 million state general fund. And the only thing that I have left on fiscal year 2025 is a chart in the physical packet I gave you. This relates to the enhancement request that we saw for the Nutrition Services Incentive Program. It's a bar chart. So the blue represents the program's funding. That orange $1 million sort of bar would represent the difference between the previous year. So just to show kind of a history of that funding. And I'd stand for questions on 25.
Any questions? Representative Oropeza.
Thank you, Mr. Vice Chair. I have a question on number 7. Are any of those FTEs federally matched?
Vice Chairperson and Representative, I'll have to verify if they're federally matched or not. I would note that only the FTE positions are deleted as part of this, not the funding, but I can look into that. They are related to administering the federal funds.
Any further questions? Dayton, I have one. So what portion of that, is that all SGF in that, the nutrition services, or is there a portion of that that's federal?
I'll have to verify where, I believe it's all federal funding in the chart that I handed to you.
Okay.
I'll verify though.
Here's all federal.
Yeah, I made it a couple of months ago, so I'll verify.
I'm just curious. Committee, further questions? Seeing none, if you're ready, you can continue on to 2026.
Okay, turning to page 6, which begins fiscal year 2026. The approved budget for 2025, excluding the reappropriations, was $3.35 billion, including $1.394 billion state general fund. The agency's request is an increase of $34.34 million, including an SGF decrease of $8.236 million. Moving down to the table below, the enhancement requests. Item 1, the agency requests $45 million for HCBS provider compliance grants. And if you turn to page 7, I have detail on that enhancement. So these grants would assist providers in becoming compliant with federal mandates concerning settings and conflict of interest. The agency states that these compliance is required to launch the community support waiver and to continue receiving federal funding. I've listed 3 categories there of providers or issues that will be targeted with the grants. The first is community developmental disability organizations providing waiver services, and this would be used to establish independent CDDOs fully separated from waiver service providers. The second set would be targeted case management organizations providing both targeted case management and waiver services. And finally, congregate HCBS providers making modifications and expanding capacity to offer a compliant, integrated, supportive environment required by the HCBS final settings rule. So the agency requested $45 million for that enhancement. The Legislative Budget Committee deleted all $45 million. The governor recommended $20 million for that item. The next item, really items 2, 3, and 4, I'll group together and ask you to look at the next sheet in your packet, which is a fact sheet on the home and community-based services waivers that I pulled from the KDAD's website when I first got KDAD's as a budget. I think it has a lot of helpful information if you're learning about the waivers. So that first row lists the name of each waiver: autism, frail elderly, intellectual developmental disability, physical disability, technology-assisted brain injury, and severely emotionally disturbed. The next row lists the institutional equivalent. So if the individual was not on an HCBS waiver, they would be eligible to be treated in an institutional setting. So that lists what that institution would be. There's also information about the purpose of the waiver, the target population, and where you would access that waiver. So that's just background information for folks who are not familiar with the waivers. I'd next direct you to the following item in the packet, which is a waiver participation report. So the 3 enhancement requests for the technology-assisted waiver, and the frail elderly waiver, and the brain injury waiver are due to the agency reporting that participation in those waivers has increased, and they're requesting funding to serve the increased population and to avoid a wait list. So I've included on this sheet the numbers of people participating in those waivers from 2020 to 2024. The table at the top also lists what the change is from 24 to the prior year in percentage, as well as a 5-year change. And I'm a visual person, so I've included some graphs there as well as the funding for the waivers. The Legislative Budget Committee did not recommend funding these 3 enhancements as part of their deletion of all enhancement requests. And the governor recommended the following amounts. So for item 2, the frail elderly waiver, if you're looking at the golden sheet, that would be item 9 in fiscal year 2026. So the agency requested $13.4 million. The governor recommended 16.1, including 6.3 million. The next item, the technology-assisted waiver, would be item 11. The agency requested 8.145 and 3.123 million from the state general fund, and the governor recommended 4.5 million and 1.7 from the state general fund. And then the brain injury waiver would be item 6 on that golden sheet. And the governor recommended 1.8 million and 719,000 from the state general fund. So again, those requests and that funding are related to increased participation in the waivers. And then turning back to the budget summary document, I'm looking at page 8, item 5, which is the next enhancement request for the community support waiver. The agency requested $2.5 million, including $953,000 from the state general fund, which would fund services for the community support waiver. The community support waiver would serve individuals with intellectual or developmental disabilities. This waiver was recommended by an interim committee several years ago. The agency has been working to develop the waiver, and this would be the first request to fund the waiver. And this would be a partial year's cost to serve up to 500 individuals. Moving to item 6, and I should note, the Legislative Budget Committee did not recommend funding that item. The governor did recommend funding it in full. The next item, the HCBS IDD waiver consultant. The agency requests $4 million to continue its contract with Public Consulting Group to develop the community support waiver, implement recommendations from the special committee on IDD waiver modernization, and to manage compliance grants. The Legislative Budget Committee did delete that funding, and the governor funded that at $2 million instead of $4 million. Item 7 is the same request that we saw in fiscal year 2025 for the Nutrition Services Incentive Program. The Legislative Budget Committee again deleted this item. The governor did fund the item at $1 million for 2026.
Representative Ballard.
Thank you. I just need to, I was writing something on the side and I missed it. So you're on 7?
Yes.
You said in that one that, making sure I have it correct. LBC did not, but the governor did at $2 million. Is that correct?
That would be item 6.
6, okay.
Item 7 was funded at $1 million, which was the agency request. Turning back to page 9 then, item 8, nursing facility for mental health settlement. The agency requests $500,000 from the state general fund to continue funding contract positions and services related to the Olmsted settlement. The funding would continue funding contract staff working with the nursing facilities for mental health to meet the requirements in the settlement and to connect with individuals exiting public institutions and in the homeless population. The agency requested $500,000. The Legislative Budget Committee did not recommend that, and neither did the governor. Item 9, Aging Services Manager. The agency requests $102,000 from the State General Fund to create an Aging Services Manager position that would supervise a number of existing positions handling elder issues, including the Older American Act, Senior Care Act, and Title VII services. The agency states, the Federal Administration for Community Living informed the agency that the state is understaffed in comparison to other similarly sized states. The Legislative Budget Committee did not recommend funding this item, and neither did the governor. Item 10, PACE consultants. The agency requests $180,000, including $90,000 from the State General Fund to fund existing positions currently funded with FMAP savings, which will expire in March 2025. So I suppose that answers Representative Ballard's question from earlier, unless that had been extended since the agency submitted their narrative. The positions aid in the expansion of PACE services and provide oversight of PACE organizations, including ensuring timely and efficient enrollment and disenrollment in the PACE program. The Legislative Budget Committee deleted those positions, as did the governor. Turning to page 10. The next couple of items are funded through the State Institutions Building Fund that I referenced earlier. The next document in your physical packet should be a copy of the State Institutions Building Fund.
Dayton, can we so are we going to talk about the other changes down below on that chart, the Sedgwick County Hospital, the add-on? Are we going to go through that?
Yes, I'm on page 10 right now, so not quite there yet, but yes, we will.
Okay.
I'm on item 12 at the moment, or sorry, actually item 11, which is priority 2 rehabilitation and repair projects. It kind of carries over from page 9 to 10. But looking at that last paper in your physical packet, this is the State Institutions Building Fund status according to the governor's recommendation. It's that middle group in that middle table there in the middle of the page. If you turn to the back of that document, there's information as to how those building funds are funded. So the State Institutions Building Fund is funded through a $500,000 tax levy on real property. So just some information there in case, for those of you that are not familiar with the State Institutions Building Fund. So turning back to the budget summary document on page 10 at the top, the agency requests $3.5 million, all from the State Institutions Building Fund, to fund the priority 2 rehabilitation and repair projects included in the 5-year plan. Of this amount, $2.4 million would be used to begin replacing the Osawatomie State Hospital medium voltage electrical system. The agency reports there were disruptions in service due to the age of the system. And the Legislative Budget Committee deleted that item. The governor did fund that item at $3.5 million. Moving to the next item, item 12, Adair Acute Care Building Remodel. The agency requests $4.7 million from the State Institutions Building Fund to remodel the A building at Adair Acute Care on the Osawatomie campus. Adair Acute Care, as you may remember, houses the federally certified beds on the Osawatomie campus. The Legislative Budget Committee did delete funding for that item. The governor did recommend funding it at the full $4.7 million. Item 13, Osawatomie State Hospital Cottonwood Building Remodel. The agency requested $2 million from the State Institutions Building Fund to remodel the Cottonwood Resource Center building on Osawatomie campus. The building includes patient recreation areas, and I've listed there some of the items that would be done to the building. The Legislative Budget Committee did delete that funding, as did the governor. Item 14, the agency requests $926,000 from the State Institutions Building Fund to remodel the Special Services Building and the office area in the MICO House, which is the reintegration facility for the Sexual Predator Treatment Program located on Osawatomie campus. The building houses the IT and staff education programs on the 2nd floor, and the project would expand the office area at the MICO House. The Legislative Budget Committee did delete that item. The governor funded it in full. So those are that was the final enhancement. I'll now walk through the other changes. Before I go through these first 3, I'd kind of group them together as they're similar in type. That would be item 15, 16, and 17. Because our starting point is the 2025 approved budget, to account for those changes between that budget and the 26 budget, we are backing out one-time expenditures. So item 15, last year's legislature approved $26.5 million in one-time spending for fiscal year 2025 for construction of the hospital. That does not reoccur in fiscal year 2026, which is why there's a deletion here. The same is true for item 16, which is the nursing facility add-on payment for nursing facility for Medicaid add-on payment. That was approved for one time only for fiscal year 25. Item 17, there were a number of other one-time projects that were smaller but collectively total $15 million that are in the 25 budget but do not reoccur for 26. And turning the page. Whereas the items that I just mentioned were in the fiscal year 2025 budget and remain in the fiscal year 25 budget, item 18 was approved by last year's legislature for fiscal year 2026, and it's $4 million for planning grants for organizations other than community mental health centers to become certified as community behavioral health clinics. So this could go to an SUD provider, a federally qualified health clinic. So this was $4 million that's in the budget, and it was approved by last year's legislature. Items 19, 20, 21, and 22 are duplicative of what was in the prior year's budget. So I think I would stand for questions on 26. Actually, I should note one more thing. On your golden sheet, There are two other items. The counties and hospital reimbursement and the e-passer transfer to KDHE that I referenced in fiscal year 25. Those continue into 2026 in the governor's recommendation. And now I would stand for questions.
Any questions? I told you it was a small budget. Representative Ruiz.
I'm not, sorry, I'm not totally, I don't totally understand this transfer of funding for the e-PASSR. Can you say it in simpler terms for me?
Sure, Chairperson, Representative. Requires a little bit of background. So a couple of years ago, funding was added to the KDAD's budget to modernize that system, and it remains in the KDAD's budget. In fact, I think if you look at the operations reappropriation for 25, that's one of the listed items. However, KDHE requested it this year, so this would essentially delete this funding out of KDAD's to transfer it to KDHE, so they would do the project. And the reason it's in this budget is because there was funding already in the budget for this.
Any further questions? Dayton, I have one. You know the answer already. And I called you immediately when I saw this for the answer. So in 2025, in the waiver services, we deleted or lapsed, I guess that's the proper term for it, $150 million in HCBS waiver services. And then I see in 2026, I haven't added it up yet here, what that change is it 70,000? Well, I guess all of them wouldn't be waiver, but there's the top 6 are waiver services. So isn't that kind of a wash? I mean, why did the agency not keep that money in the budget and lapse all of it if they were going to ask for this money?
Mr. Chairperson, Vice Chairperson, I can't speak to why the agency put together their budget in the way they did. I could speak to kind of the timing of things. The reappropriation, as I mentioned, carried forward from fiscal year 23 into 24 and now again into 25. So to expend it in 26, it would have to carry forward for another year. So just technically thinking of the timeline, that's the only information. Otherwise, I think that would be a question for the agency's folks.
And believe me, I will ask them. Any further questions? Now I will turn it over to the Representative Orpeza.
All right, I have a quick question for Dayton. How many people would be affected by the nutritional for elderly nutritional services incentive program in the state of Kansas?
Mr. Chairperson, Representative, I don't have the number of individuals on hand as far as I know. However, I think I probably have that when I get back to my computer.
Okay, thank you.
Okay, thank you, Mr. Vice Chair, and I apologize for my tardiness. I was in the principal's office, so please give me some grace. Where are we on the agenda from now? Agencies? Okay. And I see Secretary Howard here. Welcome to committee again.
Thank you, Mr. Chairman. Thanks for the chance to be here to talk about the KDAD's budget this time. I've got a number of folks with me here today. I'll just do a couple quick introductions. I'm getting my committees a little bit mixed up, so I'm not sure who's been in front of you yet from my team. But with me today, I have Deputy Secretary Scott Bruner. You've obviously seen him with the state hospitals. I have Brad Ridley, who is our Chief Operating Officer and Chief Financial Officer. I'll probably need to phone a friend with Brad a couple times here. And we also have Lee Keck, our legislative liaison, and you know Lee. Deputy Secretary Brown was not able to be with us today. So, all right, thank you. So you have some slides in front of you. I will skip some of these because I did get to do an overview with you before, and I've already tried to maybe pull some answers to some questions you've already been asking during Dayton's presentation. So I will actually start. I'm going to skip most of the overview parts that just talk about each of our program areas because we did that before. But I did want to stop just briefly on pages 8 and 9 because we did do a little bit more write-up that wasn't in my first overview that has to do with the enhanced federal Medicaid matching funds related to HCBS waivers. That relates to the reappropriation question related to the $45 million. So I did just want to stop there and talk about that. You know, way back in 2021, in the Federal American Rescue Plan Act, there was a provision in that law that provided enhanced funding for Medicaid HCBS programs. And it was an actual 10% increase in the share of the state Medicaid spending contributed by the federal government. That resulted in new time-limited dollars that were then required to be spent or strategically invested in HCBS and related services in the state. You know, this was separate than the other Medicaid bump that, you know, just occurred across all of Medicaid that was just a bump that gave states some additional funding. These dollars specifically had to then be reinvested by the state. And again, those funds have to be, the time period goes through December 31st of 2025. So as I said, as a condition of drawing those funds, we had to show the federal government, we have to make regular reports to them of how we are using and spending those dollars, and they have to approve our spending plans. And we have a document we can share with the committee that would give you those detailed plans. But again, you know, the total that that Kansas received for this was over $93 million. Most of that set in the KDAD's budget. I think you did hear about a little bit of this in the KDHE budget, where they had some programs related to home health. About $9 million of this total KDHE kind of had responsibility for. Now, we have completed a number of those projects already, but we still have $45 million that's not fully spent yet. We have plans for that funding, and I'll mention a few of those things in just a minute. You know, some of the major projects we did from this funding starting out, the big one was $51 million that related to workforce. Those were some things around recruitment and training bonuses. Those of you who've done this budget for a while would remember that, and some of those issues. The waiting list study also came from this funding. But in terms of, you know, other areas of investment that are either in process or planned, you know, some of these are awarded, some of these are yet to maybe go out in RFP, but we have some technology first projects, around $10 million related to enhancing the use of technology in service delivery. There's funding related to autism and behavioral management training services. There's funding related to career ladders for direct support workers. There's funding related to expansion of employment first. So a whole arena of pieces. Mobile crisis related to individuals with developmental disabilities. And again, we're happy to share that full plan with you. But I mean, I wanted to just give the background for that because states always were intended to have, you know, a period of time over which to expend these funds. There are plans for those funds. And if they... and if we do not spend that funding, we would have to spend that send that $45 million back to the federal government. So although in the legislative budget right now, it's lapsed, we would have to send that money back as a state if we did not expend that for the benefit of HCBS. So I just wanted to take just a minute on that. I'll go back to that a little bit later when I get to the 25 recommendations. But this seemed like a good way to just kind of provide that explanation. As I said, we're happy to provide kind of the full report that kind of gives the update on those various projects and where we're at on each of those. So I will move from there on to, I will pass over kind of these other priorities and accomplishments. We've had the chance to talk to you about those. And I will move all the way over to page 20 of this document, kind of the fiscal year 25 budget summary. You know, I really appreciated the pie chart that Dayton shared, because it really, I thought, illustrated very well, you know, what a large Medicaid agency we are. KDHE is a single state agency for Medicaid, but, you know, we have, you know, dollars in the billions from Medicaid related to our agency, and I really appreciated him showing that. So you can see, I just want to do a quick review, again, related to just some large-scale pieces of our budget. You know, on page 20, again, about 56% of our budget is federal. Just over $2 billion is federal. You can see the state general fund's about 41.5% in the current year. On page 21, this is kind of a little bit similar to Dayton's pie chart. We just kind of wanted to show that Medicaid program, that last bar on the right, that is so tall, $3.2 billion, pretty much very similar in both years. About 89% of our budget is that Medicaid funding. And as Dayton said, that includes funding for nursing facilities. It includes all of the home and community-based service waivers that we'll talk further about in just a minute. It includes funding for things like psychiatric residential treatment facilities, brain injury rehabilitation hospitals. So again, we're a very, very large, you know, Medicaid agency. The next largest piece of our budget, and that also includes the Medicaid funding related to mental health and substance use. The next largest part of our budget would be the remaining funding in the behavioral health arena, where we have about $232 million from state dollars and from federal funds, including the federal substance abuse and mental health block grant that goes to support mental health and addiction services. So again, as you kind of look down, I mean, you can continue to see as we move down, the time you get to kind of administration or operations, you're at about our actual administration program is like 0.5% of our budget. And if you add in salaries overall, about 1% of our budget. I always like to talk about KDADS as kind of, it reminds me of like the little engine that could. I mean, we are a small agency from a staffing perspective. You know, half of our staff are the surveyors that are out in the field, you know, with regard to some of our regulatory functions. But we do a lot with not a lot of administrative overhead. So I just kind of wanted to kind of illustrate that for you as well. I don't need to go over each of these charts, but again, if you would look at maybe going to page 24 with kind of the expenditures by category, again, of our total budget, almost $3.4 billion of that is aid and assistance. And we have some contractual services, the largest of which, again, have to do with some funds related to mental health, our aging commission, and Medicaid, and then salaries and wages being about $33 million of that total budget. So again, about 1% of our budget. And you can see on page 25 kind of how those positions are spread out. And as I indicated in the green bar, what's called SCCC, that's our survey and credentialing commission. And again, that's the entity that's out there doing investigations of nursing homes, assisted living facilities, other facilities, and also has a number of credentialing responsibilities for various professions. That kind of takes us, you know, into kind of the fiscal year 26 budget summary. And the charts are very similar, so I will not go over all those again. And I will just kind of try to get more directly into kind of the changes in the governor's budget and what we're here before to ask you for. So I will start with those adjustments in fiscal year 25 on page 32. I think as Dayton earlier talked to you about, I mean, obviously our budget includes changes related to the revised caseload estimates. And then the other two kind of base adjustments included in the governor's budget in terms of reductions were a reduction of $3 million from the counties and hospitals reimbursement fund. The legislature approved $5 million to pay hospitals and jails when folks are sitting, waiting to get admitted to state hospitals because there's not a bed. We were not expending that full amount, so the governor really recommended eliminating that savings in both fiscal years. And then the second item has to do with that ePassR tool. And honestly, we had requested funding in the budget last year, which the legislature approved to begin that project. As we worked through that project with KDHE, our Medicaid partner, went through some of the federal procedures, it made more sense for that funding to be at KDHE. And so all the governor's budget tries to do is shift funding that's already been approved in the base from KDADS to KDHE. And so when you had that increase at KDHE, you have the resulting reduction here at KDADS for a net of 0. So again, for that project to go forward. And again, that's a project that really automates some of the activities that have to happen when individuals are applying to enter into a nursing home, what's called pre-admission screening and resident review. That's been a very manual process where folks are emailing and faxing us forms and things like that. And we kind of got through it. We had a bit of a backlog a couple years ago. And in response to that, we began to look at what technologies might be out there. So this really will automate that process. So in terms of thinking about efficiencies for all of those facilities across the state as well as for ourselves, I mean, this project will make that an automated process. And again, all this budget item, though, is shifting money from one agency to another that's already been approved in the past. So, so those are a couple of the adjustments included in the governor's budget related to the base. And then I wanted to talk specifically about the changes with the Legislative Budget Committee. And that really has to do with reappropriations that were reflected in the governor's budget, authorizing us to carry over certain funding that the legislative budget currently doesn't authorize. There are two pieces in that. One is funding of about $3.7 million for state operations. The other is the $45 million related to the enhanced FMAP for HCBS that we just talked about. So it's about $48 million. Again, I'll talk about that for the second one first, that larger amount. Again, these are specifically the state general funds were saved because of the added 10% FMAP. Again, we are required to spend those on approved projects. We've fully spent more than half of that so far. We have plans to spend the rest. In some cases, we already have existing contracts. And should we not spend that, we would have to send the money back to CMS. We cannot retain that as a state. So I would ask this committee to consider, eliminating that lapse and restoring that reappropriation to us so we can continue those projects. And as I said earlier, we can certainly provide you the full plan. I think Representative Carpenter has seen it a few times over the last few years in terms of the plan for that funding. But again, some very significant projects related to enhancements in the HCBS world. So again, so I would ask for you to approve that. The second item is $3.7 million in state operations that the governor's budget would allow us to carry over in reappropriations that it's not currently in the legislative budget. There's the largest amount of this relates to the remaining implementation of the electronic health records at our state hospitals. That's been a significant project. We really feel like, we really have risk with some of the commitments and the costs associated with that full implementation if we're not able to retain that reappropriation. We have spent about, of that 2.1 million that is related to electronic health records, we spent about half of that, just about $1.1 million expended, the remaining amount encumbered. So we plan to spend all of that this year. It was already planned for. Again, it was more a matter of timing in terms of the implementation of that and when costs were needed to be expended. So again, the largest one is the electronic health records. There's two other items within that 3.7 million. One had to do with temporary staff that were doing some of that work I just talked about related to the pre-admission screening. When we had a big backlog, we brought on some temporary staff that we have about 400,000 of 600,000 that we committed, expended, and the rest encumbered. And again, that temporary staff was until we have, automation in place. So again, I would ask that be authorized. Those funds, again, are already expended or encumbered. And then the third item is for a study of what's called our ks information system. This was a recommendation that this committee made a couple of years ago, and it's just really been a matter of timing in terms of getting that study started. So again, if that reappropriation doesn't occur, we would not be able to move forward with that, and I think that was a really large priority of many of our stakeholders to get some more modernization in terms of some of our technologies. So there's three items in that 3.7 million. As I said, the electronic health records project, some temporary staff related to pre-admission screening, and the study of our information system. And again, in both those cases, except for the information system, those funds have been expended or encumbered.
Secretary, I don't want to interrupt. ks stands for, I'm familiar with the other ones, but ks.
Oh, gosh. I'm going to ask Brad. I'm going to phone a friend. Kansas Assessment Management Information System.
Thank you.
And we're happy to get you more information about that, should you have interest in that. As I said, a lot of our stakeholders, particularly our aging stakeholders, have a lot of interest in modernization of that and how that can, just help some of the work with them and funding and payments and those things be enhanced. So again, the other item in fiscal year 25 that I wanted to mention, and I think this is what Representative Carpenter was talking about, the governor's budget does lapse $150 million that had to do with the regular enhanced FMAP that came through the regular Medicaid caseloads. For 2 or 3 years, as that enhanced FMAP was happening, for whatever reason, that funding just continued to be left in the KDAD's budget. We didn't spend it. I mean, we didn't feel like it was ours to spend. It was just a financing piece that meant that there was additional federal funding. So that funding is lapsed. We offered that up for lapsing. The governor's office took that. And to sort of answer the question earlier, yes, you do see enhancements for HCBS waivers, but we really viewed this funding as kind of a one-time piece, and that we didn't feel that we could just dedicate that then on an ongoing basis to increases in programs that were going to be ongoing. So, I mean, again, you could look at it and say, well, gosh, there's $150 million in savings related to waivers taken out. It doesn't that just offset these increases? But we felt like that those increases were really needed to be kind of budgetary and policy decisions that were made, that we shouldn't take it upon ourselves to make those decisions for funding. That was really just a funding shift to federal and state dollars. I mean, that was really our rationale. Representative Carpenter and the governor's office agreed with that and took that funding. That's fiscal year 25. I don't know, Mr. Chairman, if you'd like me to stop for any questions now before we get into 26.
Yeah, let's do that real quick. Committee, any questions on FY25? Representative Carpenter?
So on those state hospital records, can you elaborate on why we need that system?
Yeah, thank you for the question, Mr. Chairman. Yeah, this was an early priority when, coming into this administration. I think I was kind of surprised after being gone for a few years and knowing that the rest of the healthcare world had electronic health records, that we really didn't have those at our state hospitals, except for a little bit of kind of a, I almost call it kind of a homemade system at our mental health hospitals. So, the electronic health records project, I mean, there are many, many benefits to it, both in terms of coordination of care, both in terms of various things that the hospitals need to be doing to be in compliance with surveys that the electronic health records help us with, and then potentially some financial pieces. Now, in context with this, it's important for you all to know that we've been rolling that out over the last, 4 months, 6 months, at each of the hospitals, with Larned being the last one, just going on board this month. So, I mean, this project is very close to its end. It has some ongoing costs, that are built into the budget. So again, I mean, these are costs we have incurred or need to spend, and again, really to modernize the hospitals. And if the Deputy Secretary has anything else to add about kind of why it was so important to do this project, I'll give Deputy Secretary Branner a minute. Maybe not. Yeah, and we've been talking about it for a few years, and we're very grateful for the support from the legislature to do that. I mean, when you think about, if you go to any healthcare facility now, and how those healthcare records go, we just weren't there. So even the ability to, collaborate with community-based partners and those things, very, very critical. So we're really excited. It's been exciting the last 3 or 4 months to kick that off at each of our hospitals.
Representative Vorpace, did you have a question? Thank you.
As I think about this, was there any tie with CMS? I just remember the outside community hospitals like being pushed to ensure they had electronic medical records and going forward. Is that not? Do I have a misunderstanding of that?
No, you really don't with regard to the private hospitals. I mean, we certainly saw encouragement from it about it. And you'll recall on the private side, there were various federal funds that were made available to help entities do that. That never really happened for entities like state hospitals. I mean, certainly there was an encouragement to do that, but I can't stand here and say that there was actually a mandate to do that. So.
Okay, I appreciate the clarification for my information. Thank you.
Representative King.
Yeah, thank you, Mr. Chair. Secretary, you're over DCF and KDADS, right?
That's correct.
So we've heard a lot about technology and enhancements and efficiencies there, and I don't expect you to have this answer here today, so please don't. Maybe someone can take a note on this, but and then looking a little bit more detail into some of the budgets. There's a significant amount of money going to IT and the number of IT people. And I think I would like to, and maybe the committee would too, is if you could just get a list of the technology dollars spent, and then in addition, the labor dollars that I think there was 107 FTEs, in IT and of IT people. Maybe just get us a sense, and then maybe a sense of some of the major programs that you're working on. And then as a follow-up to that, and this one might be a little harder, so I'm not sure, let's talk about this a little bit more. So don't just do this. And then we pay our contractors a huge amount of money also, and I'm sure that there's technology associated with that. So, so maybe if we could ask some of our partners, okay, if we have a $100 million contract with them, what percentage of that, again, ballpark would go technology? So, Mr. Chairman, I would make that request that we would do that, and then also I have a follow-up question then. Do you have a question on that?
No, so it sounds like you're asking for just an agency summary.
Right.
Agency, yeah.
And I don't I don't want to limit it to just KDADS if the money is, I'm sure the two agencies work really closely together. So, you know, a more comprehensive view of that.
Sure. Yeah, thank you for that. I think when some of my DCF team met with you, I think they did break out some of the IT things within DCF. I mean, you know, in terms of, you know, an awful lot of the costs are, you know, like central costs that are charged to each agency related to, you know, state mainframes and all of those pieces that really kind of connect back to the OITS, you know, in terms of a separate agency and some of those charges. But yes, we can certainly do that, and with some of the major projects. I would say when one thinks about efficiencies, you know, with these two agencies, in terms of the IT side of it, there's IT that's called HSEBIT, which is really the human services IT function. So we are sharing really a single chief information officer. We're sharing single people in terms of all of those top roles you would have in an agency related to IT between DCF and KDAS. If we did not have this HSEBIT function and you had separate functions, I mean, certainly at the highest level, you would have to have a lot of replication of that. So, I mean, it doesn't mean that we don't have to have, you know, some separate IT people in each agency, and it's pretty complicated to manage it with federal funds and all those things, but I do think it's certainly been an efficient process for the state to have a single, you know, designated entity across these two enterprises. And again, it certainly means we don't need to replicate some of those highest level IT positions in two agencies. So I think your second question, though, we might want to talk more with you about that in terms of our contractors. Perhaps we could look at a couple of larger ones or something and perhaps see what that might look like. I think it would be very difficult to get that from all of our contractors. So,
And again, that would just be an approximation, but I'm going to guess that we're going to, the number's going to be well over $100 million that were between the two agencies that would be there, including the contractors portion of that we're reimbursing them for. And it's just a great amount of money, you know, proud that we're investing in it. We'd just like to see, you know, maybe some outcomes or some measurements on what we would get with that. Then I'd have a follow-up question, if I may, sir.
Sure.
I have a hospital. I have actually two hospitals in my district, and would like to visit with someone about just about them and the potential for a rural emergency hospital on that, and the waiver portion of that. So.
Related, thank you, Mr. Chairman, if I can, are you talking about waiver related to a long-term care facility? Yeah, okay, thanks, okay. Yep.
It's Mercy.
Okay, thank you. Okay, yeah, we're happy to visit with you.
All right, thank you, Mr. Chair.
All right, thank you. Committee, any other questions on 25 before we roll in Representative Rivas?
This is probably related to 25, 26, and you don't have to answer this today, but I know with all the COVID money and all the many silos of money that came from the federal government, a lot of these programs and funding is now drying up or fading out. So inevitably, when that all started, we had to hire people, so I'm sure the FTEs went up. So I'd just like to know, where are you at with FTEs prior to COVID? Where are you with FTEs now? And you cite you have a lot more efficiencies you've been creating. So when I hear efficiencies, I think a reduction in FTEs is what my brain goes to. So I'd just like to see what's the trend and trying to kind of maybe stem the growth, yet still get the services provided.
Sure. Yeah, you know, we have some broad, thank you, Mr. Chairman. We have just a broad FTE charts in this document, but we can certainly tie that back to COVID as well. So, and yeah, thanks. Thank you.
Okay, committee, if there's no further questions on 25, can we roll into 26?
All right. Thank you, Mr. Chairman. I'm now on page 37, related to the fiscal year 26 budget adjustments. Again, this first page, before I get into the governor's enhancements, just relate to the consensus caseload estimates, and then those same two adjustments the governor made in the base, the $3 million reduction related to the county and hospital reimbursements, just based on what that demand had been for those funds, and then the transfer of the e-PASSR system. So we would certainly ask for inclusion of those. The governor recommended 10 enhancements in the KDAD's budget. Those fall into a few buckets. I will talk through those, but, essentially, a couple of those fall very much into what it takes to get our new home and community-based services community service waiver stood up. Another group has to do with growth in some of our home and community-based service waivers to avoid waiting lists. Some other funding related to some modernization in the IDD world, and then some funding related to a federal cut in nutrition. So although it's 10 items, that they kind of fall into a few buckets. And then the capital improvements pieces that Dayton talked about that come from the state institutions building fund. I don't think we've come in front of this committee this year to talk about HCBS waivers yet. So I might just take like 1 minute just for those members who've not maybe been on this committee before to say, what is a home and community-based services waiver? This is so HCBS waivers, home and community-based services waivers, are really authorizations that we get from the Federal Center for Medicare and Medicaid Services. There are Medicaid waivers where where beneficiaries are allowed to receive services in their home or community rather than in an institution. Medicaid typically would fund, nursing homes, for example. But they might not fund like home care services that help a person stay in their home, help them get dressed, all those kinds of pieces. So these programs were initiated federally in terms of the ability to ask for waivers, and it's an extensive process to do so in the 1980s. So as I said, historically, Medicaid only really provided funding to institutions like nursing homes. So if you needed skilled nursing, if you needed personal care services, you really didn't have an option but to enter an institution to access those benefits. So what the waiver programs then do, again, is allow us to provide those services in community-based settings and people's homes. You have to do a lot of things if you have a waiver program, and you have to demonstrate that the waiver doesn't cost more than it would have cost to serve people in that institutional setting. There's a lot of things around the protections of people's health and welfare. And you have to ensure the services follow an individual and person-centered service plan. And so we in Kansas, we've been operating waivers, really since the early days. The IDD waiver, intellectual and developmental disability, was created in 1991. Our first waiver was actually the physical disability waiver a few years before that. But we currently operate 7 home and community-based service waivers. The largest are the intellectual and developmental disability waiver, where otherwise individuals would need to be served in a state hospital or in what's called an intermediate care facility setting. The physical disability waiver and the frail elderly waiver for individuals with physical disabilities. Or needing those kinds of supports, again, otherwise to be served in a nursing home. We also have a brain injury waiver that I'll talk more about, and also a technology assistant waiver for kids who need technology supports in order to be able to live, and who otherwise would literally grow up in a hospital. That waiver was literally established because a child in another state had lived in a hospital for 16 years, and the waiver was named after that child. And so, again, I just wanted to give a context for what those are. It's a large part of our budget. It's a large part of state resources, but they're really, really critical resources to allow people to, remain in their homes, receive services in communities, rather than enter into institutions. So this, with that context, I'll kind of move into the enhancements. And the first enhancement that the governor has recommended is funding of $2.5 million, just under $1 million from the state general fund for what will be a new waiver in Kansas called the Community Support Waiver, with a goal to serve up to 500 individuals in fiscal year 26. And this would provide funding for the last quarter of the year. This waiver aims to reduce the current wait list that we have on the IDD waiver by offering essential services for those who may not require the full menu of comprehensive services. So it'll operate targeted services and supports, really promoting integration, autonomy, and inclusion in the community. Again, this has been a large legislative conversation for the last 2 or 3 years, a number of interim committees making this recommendation. So again, this would be the first time we actually see funding for services for this new waiver in this budget. Again, a main tool as we think about trying to continue to reduce the wait list on the IDD waiver. This legislature was very generous with this agency last year, provided us funding to reduce our waiting list on the IDD waiver by 500 persons. But again, this is another important tool in that toolkit. So that's the first item, is really to launch that waiver. The next 3 items have to do with the frail elderly waiver, the technology assistance waiver, and the brain injury waiver. In each of those cases, there is not currently a waiting list for those waivers. What the governor's recommendation does is add funding based on growth in each of those waivers to increase the number of individuals served and to ensure that a waiting list would not need to be started. Right now we have waiting lists, as I said, on the IDD and the PD waiver. There's been times in the past where we've had a waiting list on the frail elderly waiver, but again, the governor's funding would ensure that that would not have to happen in fiscal year 26. So the frail elderly waiver, the governor's budget would add $16.1 million, about $6.3 million from the state general fund to increase the number of individuals served. And without the funding, certainly some number of those individuals needing services might need to seek those services within an institution, costing the state more money in the long run. We've seen the number of eligible participants increase by about 7%. You can see a chart on page 42 that kind of shows that caseload trend. It's really been a consistent movement up, and we've really seen increased demand since COVID, I think, as more individuals seek to be able to remain in their homes. So again, the government would fund that projected caseload. And just as an aside, maybe I didn't say this piece, but I think an important part when we think about the HCBS programs, from a federal perspective, those are not entitlements. So like in the regular Medicaid program, you could never have a wait list for anything because that's an entitlement program. So if a person's eligible, they get the services. That's not true with the HCBS program. So it's a policy decision, but that also means that the HCBS programs, from a state perspective, the state doesn't include those in the consensus caseload process. So that's why you always see large funding requests for HCBS. In the remainder of Medicaid, that gets played out in that consensus caseload process between the legislature and the governor's office and the agency, and really just typically just gets funded. But these always end up having to be, really policy discussions because HCBS is not included within consensus caseloads. So again, and it's not because it's not an entitlement. So again, the first is the frail elderly waiver. Again, you can see those numbers going up in terms of the demand for those services, with eligible individuals, and again, about a 7% increase in this past year. The second waiver, where the governor has recommended additional funding in fiscal year 26 to not have to start a waiting list, is that technology assistance waiver I was talking about. These are children. This is a waiver for children aged 0 to 21 who require life-sustaining medical technology to live. These are very medically fragile children. Part of the services under this waiver, come from specialized nursing care. you may hear from some of those entities in your budget hearing tomorrow, some of those nursing agencies that do some of that work, some of those home care agencies that have those specialized nurses. So again, this helps, this allows those children to grow up with their family in their homes. And without this, we certainly risk inadequate support for this population, and in some cases, that might mean that a child might not be able to leave a hospital. We've seen an 11% increase in the number of eligible participants in the last year. The governor just carries forward that projected caseload growth to add that funding, again, to not have a waiting list for the technology-assisted waiver.
Secretary, can I
Yeah.
make sure, I'm comparing the budget summary for FY26, and I'm looking at the frail and elderly waiver growth on page 38 that shows all funds roughly 16 million, 6.3 SGF. But then when I look at the frail and elderly on the budget summary, it's showing the agency that it's a $3 million difference. It's saying 13.3 million, including 5.1 SGF. I'm just wondering why the discrepancy between the two.
Let's follow up and get back to you. I don't have that other document in front of me, and so we can work with Dayton to sort that out.
I just want to make sure that we're not mixing drinks here.
Yep.
Okay, thank you.
No, absolutely. We wouldn't do that, would we? So we wouldn't do that. I mean, I would say that if you look at the yellow sheet from Dayton in terms of what the governor put in the budget, I think those numbers do match what we have on our document. So in terms of what the enhancement amount is, so yeah. So the last waiver I wanted to talk about, where the governor has recommended increased funding, again, to address the caseload, projected caseload increases, is the brain injury waiver. The brain injury waiver is different from some of the other waivers because it is intended to be a rehabilitation waiver. So some of the other waivers, a person with a severe physical disability will likely need to continue those services. The brain injury waiver is intended to be a shorter term service. So you think about someone who's gotten a brain injury from a motorcycle accident or a stroke, and there's some of that, sometimes the immediate rehabilitation may happen in a specialized rehab hospital, but then there's additional rehabilitation that needs to happen for that person to regain as much of their skill level as they can. So it's a rehabilitation waiver. Folks may stay on the waiver for 1 year or 2 years or 4 years, but it's not intended to be like a lifelong waiver. And I say that because I think on the brain injury waiver, it's just so critical that folks who need that service after that kind of an injury don't wait for that, because if they sit for weeks or months or years without getting those services, they're not likely to get as much functionality back. I mean that's just a fact. So again, it's a rehabilitation waiver, so it's important that folks can access that in a timely manner. We've seen an increase of about 6% over the course of the last year. If you look at the chart we have on the page about caseload trends, you'll see a really high, high increase coming, in terms of those caseload trends. I would remind folks, or maybe remind folks who've been on this committee before, and then maybe perhaps for newer folks, that there were some policy decisions made by the legislature a few years ago, around 2018, 2019, to expand the scope of the brain injury waiver. When it started out, it was a traumatic brain injury waiver and served adults. So you think about, the motorcycle accidents, car accidents, getting hit on, the head injury damage through some form. It was expanded through legislative action to a broader brain injury waiver that included acquired brain injury, that would include strokes. It was also expanded to include children. So again, there was a policy decision that opened that door wider. So part of the reason why we see a larger caseload growth is because the eligibility is just wider through prior policy decisions that were made. Again, a rehab waiver. So those are three enhancements that we think are really critical from a policy perspective to allow individuals to access those services who are eligible for those services, who again, might otherwise need to seek services from the standpoint of the physical disability. There might be some individuals who might need to enter a nursing home. So again, those are those three HCBS waivers. The next enhancement that the governor has recommended is funding of $2 million from all funding sources, about $1.5 million from the State General Fund for a partnership that we've entered into with Public Consulting Group. In order for us to really get this waiver launched, we knew we didn't have all the expertise we needed internally to do that. So we reached out and contracted for resources, and they're really helping us to develop the community support waiver. There's a lot of facets associated with putting in a waiver request, developing rates, developing services. I mean, it's not an easy process, and also to implement a number of other recommendations from the IDD Modernization Committee. So again, we think their expertise is essential. And again, these would not be ongoing funds. I mean, these would be funds to allow us to continue that process and some of that modernization work. A couple more things that relate to the home and community-based services side. The governor has also recommended one-time funding of $20 million from the State General Fund for grants to address system-wide changes to meet federal requirements related to our home and community-based services system. These grants will address issues around conflict of interest compliance and also HCBS provider expansion. So $10 million related to issues to do with conflict of interest. This will help existing providers in our system restructure their services to establish new independent entities. I mean, there are, and I think many of you, I'm sure, have been hearing from your constituents about all of the changes going on in the IDD system. One of those has to do with conflict of interest. We have very clear direction from our federal partners that we have to address that conflict of interest. One of the few times I've actually seen a federal partner put something in writing, so it's very serious. But we really think, we'd like to help those providers make that transition successfully, and having some one-time grants to help those providers to either separate targeted case management functions from service delivery or establish new independent targeted case management entities. So part of that's conflict of interest. The second part has to do with provider expansion. Again, that has to do with really meeting the growing demand and also helping us to meet some of the requirements under what's called the federal final settings rule that's been in place really for about a decade federally, that has to do with really inclusion in the community. I mean, a good example there might be an assisted living facility that wants to offer home and community-based services for elderly, wants to be a provider for that. Sometimes those institutional settings don't meet those standards. They may need to do things that can help them to meet some of those standards related to privacy or autonomy of the individual. So again, this $20 million is one time, not intended to continue on. And then the last enhancement, except for the capital improvements, is in nutrition services. We found out after the legislature left last year, sometime this fall, we suddenly got a cut from our federal partners at the Administration for Community Living of $1 million from what's called the Nutrition Services Incentive, not the Administration for Community Living, from the It's a Department of Agriculture program that provides grants to organizations that sponsor elderly nutrition sites. We suddenly got a reduction of $1 million from that. I mean, $650,000 from that. We already had sites in our state that had waiting lists for nutrition services. So what the governor has done is make up that funding. She added $1 million. The cut was about $650,000 to make up that funding in loss of nutrition funds. So Again, that's intended, again, to help those nutrition providers to continue to sponsor their elderly nutrition program sites and in some cases address some wait list issues. The last things I would just mention are on the capital improvement side, on page 50. These come from the State Institutions Building Fund. I won't spend a long time on these. I know you have a building committee, but the governor recommended $3.5 million to fund what are kind of the second priority of rehabilitation repair funds that we included in our 5-year capital improvement plan for our 4 state hospitals. There's a variety of projects included there. The second one is just under $1 million, also from that State Institutions Building Fund, that would allow for a significant remodeling project at Osawatomie, in the Special Services Building, and in the office area of what we call the MICO Reintegration Facility. There's things related to asbestos abatement, as well as just repairs, site drainage, things like that. So we've done some work previously on our Special Services Building, but we've got water damage, we've got missing windows, we've got things that could really threaten the stability of the building long term. We really need to do this to protect some of our IT functions that sit in there and staff education and things like that. We also need to relocate medical records that are being stored right now in buildings that are scheduled to be raised. The legislature funded a number of raising projects for some of the older buildings, so we need to relocate some records. The second project would expand some office space at our sexual predator treatment program reintegration facility that sits at Osawatomie. And then the last one, in terms of those additional capital improvement projects, the governor recommended $4.7 million from the State Institutions Building Fund for a remodeling project in the Adair A building. We'll really renovate the building to update flooring, plumbing, electrical, HVAC. And again, this continues our work towards moving the building to single occupancy rooms. It continues really a project that we started a couple years ago with some work in another building on campus. So again, we want to move the building to single occupancy rooms for improved patient management, staff safety, and more efficient treatment. Mr. Chairman, the remainder of the document is really, we give you some information on caseloads related to the waivers, some information about performance-based budgeting in terms of the number of surveys we've done, some things like that. But I would just close and just ask this committee's support, first for, addressing the reappropriations that didn't take place, especially the $45 million related to the enhanced FMAP for HCBS. And then I would also ask the committee to consider the enhancements that the governor recommended, particularly related to our home and community-based services system. Thank you, Mr. Chairman.
That was a lot. Take a breath.
That was a lot.
So Representative Oropeza has a question on the Nutrition Services Incentive Program. Representative Oropeza.
Thank you, Mr. Chair. So my question is, so you've had a cut from the federal funding. Do you anticipate that will be continued to be cut? And the only way to support this program would be SGF?
Yeah, thank you for the question. I think it's hard to know. I think we're all looking, beyond this program, there's other federal nutrition dollars that come to us through the Older Americans Act. I think we're all looking, I don't know if the word is maybe a little bit anxiously, as the federal government begins to look at its next budgeting process. We certainly see a lot of things out there in projections that would suggest we might need to be looking at reductions. But again, I think we'll know a lot more in the next couple months in terms of what that looks like.
Okay, thank you.
Okay, Representative Steens and then Representative Rivas.
Thank you. Thank you, Mr. Chair, and thank you, Secretary Howard, for your presentation. I just had a really quick question about the home community-based waivers. We hear a lot about that, and I've been meeting with people, obviously, here and trying to understand that. And so when we say, I'm just going to give some numbers, and I know they may not be all correct, but like there's a 4,800, wait list for IDD, and or, frail and elderly. Now, just so I understand, just because I'm just trying to like somehow break this out. Those are not all people with immediate needs, right? Because some people go on the list to wait, just so I understand, because I don't want to misquote that or anything.
Yeah, thank you for the question, Representative. That's a great question. What you're talking about, I think particularly relates to the IDD, or the Intellectual and Developmental Disabilities Waiver. Although we have wait lists on the physical disability waiver, the movement of that waiver is far more rapid, and so folks don't tend to wait for the same kinds of period of time. But for folks on the IDD waiver, because the state at points has had 10, 12, 14-year wait list, parents may have a young child, they will go ahead and put that child on the wait list in hopes that when that child is ready to leave school at the age of 21, the services would be available. So you're right about that. We invested a little bit of those ARPA funds, well, not a little bit, about $1 million of the ARPA funds towards a very extensive wait list study with the University of Kansas to try to understand that piece better. And we learned a lot about, not just maybe folks who don't need services immediately, but also folks who maybe don't need all of the comprehensive services that our existing waiver provides. And that's part of why the movement to create this community supports waiver that will allow folks who maybe don't need residential supports, maybe they can still live with a family, maybe they can live on their own in the community, but they need some supports to allow some different options for people's individualized needs. It also wouldn't be as costly as the full waiver. But you're absolutely correct. When we say there are 5,000 people waiting or that sort of thing, not every one of those persons on the IDD waiver needs support tomorrow. Absolutely.
Thank you so much for that clarification.
Representative Rivas.
Thank you, Chair. Thanks for the presentation, Secretary Howard. So, quick question, with get the rest of it, but when did they change the legislation to start expanding the brain waivers? Just 2 years, 3 years, last year? Okay.
It was right, but it was right towards the end of the prior administration. So I want to say 2017, 2018, probably. Yeah, it took a while to get it on board. I mean, I think it was just kind of when I came in 2019, I think it was just becoming active. So that's kind of the general time frame. Because again, it took a while you have to amend the waiver, you have to go through a whole process to do all of that. So yeah.
So what that leads me to is, so these all of them have you want a lot of money to avoid having to start a waiting list. So I get the impression there are no waiting lists, but in your trend lines show the straight line keep going up. I guess my question is, if we don't have a waiting list, but we know we may need to increase services, why do we go for like $16 million on this one? I mean, could we, allocate a fourth of that, knowing that we may have to slowly incrementally go up as the trend line?
Yeah, thank you for the question. I mean, in terms of waivers that have waiting lists, two have a waiting list today, the Intellectual and Developmental Disability Waiver, and then the Physical Disability Waiver. Both of those, the waiting list has gone down quite a bit, based on the funding that the legislature put in last year to support 500 individuals. And we're actually, getting very close to maybe not having a waiting list on the Physical Disability Waiver. So to your question, I mean, what I would say, these are our best estimates in terms of people who would apply and be eligible for services without there being a waiting list. I mean, it's a policy decision, whether to have a waiting list or whether to say, X amount of wait is okay or appropriate. I mean, the thing I always would just say about it is we know that the waivers are less costly than institutional alternatives. And I'm not saying that every person who isn't served because there's a wait list would opt for that institutional alternative, but in some cases a person may not have an option but to make that choice. And we do know that the waivers are more cost effective. For example, the PD and FE waivers and nursing facility care, and they have to be federally. So again, it's a policy decision. These are not entitlements. I think there's been a lot of consensus around particularly the brain injury waiver as a rehabilitation waiver, the impact of what having a wait list on that might mean. And in other cases, there have been wait lists on, FE at some points in time, I would probably distinguish the brain injury waiver and the technology assistance waiver just in the context of who the populations are that are served, maybe from the other waivers. So,
Representative Ballard.
Just to follow up on that, I mean, for years, we never had a physical disability waiver. I mean, our waiting list. We just never had one. And
that's right.
it's not like it slowly crept up. All of a sudden, we had a physical disability. And I don't think we ever figured out why we had a waiting list, did we?
Well, I mean, just the math of it, right? I mean, we have a waiting list because we had more people apply and be eligible for services than we had funding for. So, I mean, that began to grow. You know, I think for a number of years there was not funding added in to address waiting lists. You know, and if you think about even back 4 or 5 years ago, I mean, this legislature put a lot of emphasis on workforce. You know, there's a lot of concerns about whether or not there was the capacity to serve additional people. So you spent a lot of resources really trying to enhance the workforces in those systems. At the same time, that also meant that funding wasn't added on the services side. Again, trying to build the capacity of those systems. And again, over that time, we certainly saw that those wait list numbers grow. But again, I think particularly around COVID, I think rightly so, the investment of those resources in the workforce, which really played out through the rate increases that this committee and the legislature approved for a few years. Now,
The most important part is that for physical disabilities, we need to start as early as possible. Because if you can rehab and they get off, you're fine. With the IDD, you get on, you don't get off. So, I mean, it's this really hard part of how do we do that. And then with the difference in brain injury, then we added the acquired.
that's correct.
And that created a dilemma.
Certainly the increased scope of the brain injury waiver, increased eligibility, increased the demand for it, right? I mean, still a rehabilitation waiver, still individuals who, you know, without receiving those services probably wouldn't regain as much capacity. So, but you're certainly right, Representative Ballard. Increasing that door meant that we had more eligible people to access those services. And again, we certainly want people who, you know, suffer from a brain injury, whether traumatic or acquired, to reacquire as much functioning as possible so they can go back in the workforce, stay with their families, all those things that are so significant to quality of life and also to just quality of life in our communities.
Thank you very much.
Representative Steens.
Sorry about that. Thank you, Mr. Chair. Is there a reason, Secretary Howard, why that brain injury waiver goes just up to 65 years of age, just out of curiosity?
I don't know that I know the answer to that. Yeah, I don't know the answer to that. You know, I think it was at 65, and when it was expanded to acquired, it was also expanded to include children. You know, I don't know. Might look back on the history of that a little bit.
Okay, thank you.
Yeah.
Committee, any more questions? I think we've reached the end of everybody's collective mental capacity today. Secretary, Dayton? Okay. Let's, we'll do that now. Dayton has some responses to some of the questions. Go for that.
Okay, the question was asked when the FMAP deadline is to spend that bump. It is December 31st, 2025. That's the information I have as of November. So that would be, and the agency does have a schedule. The projects are anticipated to end by that date. The next question was about the nutrition services program and how many people it serves. I personally can't identify from the data how much that specific part of it serves. However, I have a senior nutrition chart with all the funding sources, and I can provide that to the committee at either tomorrow's meeting or Friday. So you'll see the total for 24 was 19.3 million for senior nutrition, and the nutrition services incentive program was 2.5, so about 13%. And it served the total 19 million served 32,000 people in that year. Finally, you had asked, Mr. Chair, about the difference between the frail elderly numbers. The agency, as part of the process, the agency submits its budget, there's an appeals process, and by the time of the appeal, so they submit their budget in August, and by the time of the appeals in November, they just had more months of data to better estimate what their need would be, which is why the governor's recommendation was 16.1 million versus 13.3 million in the agency request. So that's a question of timing, really, a better estimate in November.
That's helpful, thank you. Okay, all the clarifying information. Secretary Howard, thank you so much for you and your team for showing up today. Everybody who's here, your patience to get through a rather lengthy meeting again. So with that committee, we are adjourned, and we will see you again tomorrow. Thank you.